Hi, this is Brandon Steele with ChiroUp. Today what I want to talk about is being a patient advocate. And often when somebody comes into our office, we think that they just want to get out of pain as quick as possible and that we're the next person in the chain to get them out of pain. However, sometimes we're just one spoke in the wheel of their pain presentation or their general health. And I find that increasingly I'm seeing a lot of patients getting epidural steroid injections and even more recently with radiofrequency ablations. And when we start to see radiofrequency ablations or neurotomies on the upswing, my question is well, what's going to happen down the road with that patient? And I'm not saying those are bad procedures. In fact, I send people for those procedures on a fairly regular basis because sometimes the pain is very severe and they've gone through a lot of different those different spokes in that wheel and they haven't gotten the pain relief. However, I always try to educate that person on here's what they're going to do to you, here's what to expect. In fact, there was a recent study by Smuck in the journal, a spine journal, that looked at what happens to those people years down the road, and they found about a 14 to 15% increase in disc degeneration and joint degeneration at that affected level. And the question is why? And I think that if you start burning nerves and you start to remove the proprioception and the pain from that area, that it's like removing the check engine light in your car or putting a piece of black tape over that check engine light. There's still a problem there. And that if we don't go after, what is the problem to begin with, why are they getting that facet syndrome, then there's going to be an issue that comes down the road. They're going to keep on overusing that area if we don't address the true issue, whether it's sitting or lifting or their job or the way they sleep. And then they're going to keep on irritating that tissue over and over again until that becomes even more degenerated, and then it goes along that cascade, which eventually ends up in stenosis. So I think that one thing that we can do is one, provide all the options for that patient, and maybe radiofrequency ablation is an option. However, we also have to educate them on the benefit of conservative care on looking at why this is happening, treating with manipulation or any kind of mobilization or any kind of modalities might be a better option, and to keep that level at bay so we prevent those future degenerative changes which have much, much bigger consequences. I think that if we can provide our patients with all the options and then try to educate them on why conservative measures are usually the best option to begin with, we'll have a better practice, and our patients have a better understanding of what we do and why we do that, and fit into the medical system as best as possible. Thanks.